Growing calls to end stay-at-home orders and get Texans back to work, and state leaders are responding.
We're now beginning to see glimmers that the worst of COVID-19 may soon be behind us.
But there are new warnings about the risks of moving too fast to lift restrictions.
We have to have some straight talk, with the population about the virus and its risk. And this virus is not going to go away anytime soon.
This week on State of Texas, we take a closer look at the plan to restart the state's economy while keeping Texans safe. Hello, and thank you for joining us for this special edition of State of Texas. I'm Josh Hinkle, and today I join you from just outside of downtown Austin, where, as you can see, there's not much traffic because most people are following the governor's stay-at-home rules, except for essential activities. But there are calls for state leaders to loosen those restrictions. Demonstrators rallied outside the governor's mansion on Thursday to lift the state's stay-at-home order. Organizers say they're sending a message that they want to be able to go back to work sooner than later. Protests like this are starting to pop up around the country. It comes as more Americans say they're more worried about the economic impact of the virus than they are about the health risks. The 538 website tracks daily opinion polls. They show just over a third of Americans say they are very worried that they or someone close to them will become infected with the coronavirus. But well over half of Americans say they're very worried about the coronavirus's effect on the U.S. economy. One sign of the economic impact, long lines of people who need help with food. Earlier this week, more than 1,500 cars lined up in East Austin to pick up boxes of free food from the Central Texas Food Bank. We've watched scenes like this play out across Texas as people who've lost their jobs look for help to meet their basic needs. It's with this backdrop that the governor announced his plans to begin to restart the economy in Texas as more coronavirus cases continue popping up across the state, and there are warnings about lifting those stay-at-home orders too soon. Our Maggie Glenn takes a closer look.
Josh, the governor has issued 3 new executive orders, the first of which establishing a new strike force. The team is comprised of state leaders, doctors, and business experts who will gather information and make recommendations about the best way to safely reopen businesses here in Texas.
We're now beginning to see glimmers that the worst of COVID-19 may soon be behind us.
That's why Governor Greg Abbott says he's ready to start reopening businesses around the state in phases. One of his executive orders approves a retail-to-go model where businesses can bring their employees back to work, but customers don't set foot in the door.
You simply order the product and you pick it up or have it delivered to you. Because we've seen that this model works while also containing COVID-19, we believe that all stores in Texas should be able to operate retail to go.
The governor also closed schools for the rest of the school year, but the Texas Education Agency says at-home learning will continue. Another order loosens his previous mandate that postponed all non-emergency surgeries.
Texas has plenty of hospital capacity. We have a solid supply chain of PPE, and many of our doctors and nurses have patients who desperately need medical treatment.
On a conference call following the governor's announcement, the Texas Democratic Party expressed concern for a lack of testing.
It is premature to open until we have clear testing.
Governor Abbott said more testing is available daily and will impact more decisions to come at the end of the month.
Additional openings will be announced on April the 27th after further input from the advisors and the medical staff.
The governor says if a resurgence appears after businesses across the state start to reopen, he would consider closing individual communities down rather than closing things down on a statewide level. For State of Texas, I'm Maggie Glenn. Josh, back to you.
Thanks, Maggie. We want to take a deeper dive into the governor's plan now, so we turn to our state politics reporter, Wes Rappaport. Wes, what's this plan look like?
Hi, Josh. The governor covered a lot of ground here. Maggie mentioned schools. He also allowed all state parks to reopen Monday morning. So get those hiking shoes on as long as visitors and workers wear face masks and follow proper social distancing measures. But we're getting the most questions about shopping. Let's talk about what retail to go really means. The governor is allowing for businesses to sell goods for pickup, drive-through, just so long as customers don't enter the store. What does that mean for employees? Well, your boss is required to train you on disinfection and hygiene practices. Employees must be checked before entering businesses, checking for a cough or sore throat, shortness of breath, fever, or known contact with a COVID-19 patient. All employees are required to wear face coverings, and you have to keep that 6 feet of social distancing. Now for customers, make sure you're doing all payments over the phone and online if you can, and keep contact to a minimum if those aren't options for you. Make some room in the trunk or the back seat of your car because employees are being asked to put your items there, so they're keeping contact down. And wash your hands or sanitize after any interaction. For doorstep delivery, don't let anyone into your home. Prepay and then have them leave the items outside. We've put this information up in detail online for you. In the meantime, I checked in with Dr. Gerald Parker, director of Texas A&M's Biosecurity and Pandemic Policy Program. He shared with me insight into what comes next and why we're a long way from getting back to normal. We spoke a little more than a month ago, and you were talking about the pandemic having these sort of 5 stages. Where are we now, and where do we move to next?
Well, yes, I propose that we are in 5 stages of the COVID, and we've already been through phase 1, which was containment. We tried to slow the spread of the virus to the United States, but it ultimately got here as we anticipated. And now we're in phase 2, which is mitigation, and we're all suffering through the mitigation phase of this, where we're almost a complete lockdown and staying at home and so forth, which is so necessary to prevent potentially catastrophic loss of life and so forth. But we really need to move on to the next phases of this crisis. We cannot stay in lockdown forever, but we need to do it in a safe manner. So I hope sooner rather than later, we're able to move into phase 3, which I call containment phase, but before a vaccine, because a vaccine is going to be at least 18 months, if not longer. And we hope there will be a vaccine. There's a lot of scientific knowledge we still have to gain there, but we need to move on to the next phase, and there will be some specific examples and objectives with phase 3. We need to really prevent unnecessary death. We need to make sure our hospital capacity is up to snuff so it's not overwhelmed, and we need to do measured reopening of our economy and get our industry back to work. And one of the fundamental things that's going to enable that, though, is lab testing, so we can have a better understanding of how widespread the virus may be in our communities and what level of population immunity we may already have.
You know, we've heard from a lot of folks, specifically in West Texas, saying, business owners saying, let us get back to doing business in a responsible way, practicing social distancing. You know, maybe we'll do by appointment only so that you're only having a certain number of people in the establishment at a time, that sort of thing. Is that a responsible way to approach this right now, or do you think that we still need to be really focused on that mitigation at this point?
I think we're going to have, sooner rather than later, have to start some measured reopening of the economy. Keeping our economy completely shut down, other than, beyond just essential businesses, also has significant public health, medical, and mental health, in addition to just, associated with us losing jobs. So we can't stay on this lockdown mode forever. But I really believe in the spirit of innovation of our small businesses, particularly in Texas. And they are going to be clever beyond our imagination and knowing how to measurably open up their businesses and industry in a way that can do it safely. They have the most interest in making sure when they do open their business, they can do it safely.
Relating to businesses and to schools, what are some of the biggest obstacles from your perspective in terms of being able to reopen some of these places?
This virus is not going to go away anytime soon. It's not going to be like SARS in 2002, 2003, when we contained it, and actually we haven't seen the virus again other than in laboratories. And this virus is probably not going to go away. So we are going to have to, in addition, once we get back, beyond, the phase of flattening the curve, we're going to have to manage the curve. And we know that we're going to have to live with some type of risk, like we do with seasonal influenza. And, hopefully we will have a vaccine in 18, 24 months when that comes around. But we're still going to have to manage the curve before we have a vaccine. And that's where we get back to some of the basics of public health. When we can get the cases down enough so that we can empower public health authorities, they're probably going to have to, I call it, hire an army of public health frontline providers that can do the contact tracing and help isolate those who may be infected. And we're going to have to ramp up our diagnostics much more.
So you're saying the main key in terms of getting people back to work, which is the question that a lot of folks are asking us, is that ability to do widespread testing?
I think it's one of the keys. You know, there are a number of keys, but having laboratory testing is really essential. We're still flying blind in some respects. We've made a lot of improvements over the last month nationwide on rolling out new tests and getting the private sector engaged in manufacturing and getting FDA approval, emergency use authorization approval for testing. But we also need to ramp up what's called antibody-based serology as well, in addition to testing for the virus. But it really is one of the key essentials so that we're not so blind.
I asked Dr. Parker what he thought about the timeline for getting people back to work. He told me it's not easy to predict, but Parker said he's encouraged that Texas has not seen the large spike in cases that we've seen in some other places. He also said it's important to empower local officials to make decisions about assessing the risk within their own communities. But overall, Josh, he was cautious, saying the state needs to move forward in what he called a very measured way. Back to you.
Thanks, Wes. President Trump is also working with members of Congress to begin to reopen parts of the economy around the nation. He named 5 Texans to the Opening Up America Again congressional group. The list includes House members Kevin Brady, Henry Cuellar, and Kay Granger, as well as both Texas Senators John Cornyn and Ted Cruz. Congressman Lloyd Doggett is not part of that group, but the Texas Democrat is calling for caution as the process moves forward.
Well, of course, all of us want to return to normal, but my concern is that we listen to the doctors, not the politicians who may doctor the truth. We have to rely on medical science here, not on wishes and hopes and political aspirations.
Doggett also said it's likely that Congress will approve more stimulus funds to help individuals and businesses in the coming weeks. COVID-19 puts a new spotlight on racial disparities in Texas. African Americans are dying at a higher rate from the disease. Now, one state lawmaker is getting bipartisan support for a plan she says will save lives. First, a judge approves a plan to give more Texans the chance to cast a ballot by mail. The ruling aims to protect voters from the coronavirus, but find out why it may never take effect.